This evening we're launching the new Mental Wellbeing Fund for Birmingham and Solihull. Birmingham and Solihull Mental Health Foundation Trust provide mental health services, but as we all know, there's a lot of stigma against people with mental health problems. And this evening, to have so many international cricketers, Tim Witherspoon, the former world heavyweight champion, so many of our sponsors, we have Sovereign Housing and Support, we have Unity FM, we have Westmill Foods, big companies here, and it's just so encouraging because people are really excited about this, and it's really so exciting for me because people know that mental health and mental ill health are issues that we all need to be concerned about. So really excited and really very appreciative of the support.
Birmingham and Solihull Mental Health NHS Foundation Trust joined forces with the Lashings World XI cricket team to raise awareness and funds for the Trust's Mental Wellbeing Fund. This event was held on Saturday, September 13th, 2008 and saw the team of staff from the Foundation Trust take on the Lashings World XI team. The event came together with a display of cricket and followed by a fun charity auction where everyone got to bid for items to raise further funds for the Mental Wellbeing Trust. Ranjit Sondi, chairman of the Heart of Birmingham Primary Care Trust.
Well, a foundation trust is slightly different from the kind of trust that used to exist before. A foundation trust is relatively autonomous. It has got its own governance mechanisms. It is at an arm's length from the rest of the NHS. It works with the community to provide the services that that community needs. Therefore, a foundation trust really has to be very closely involved with this community so that it can provide exactly what that community needs.
Research shows that 1 in 4 will suffer from mental health issues in their lifetime. Tanveer Chaudhary, community development worker for Birmingham and Solihull Mental Health NHS Foundation Trust, explains how they are overcoming the stigma.
I mean, there's a lot of stigma attached to mental health services, especially within the Pakistani Kashmiri community. 1 in 4 people are going to suffer from mental health issues within their lifetime. And what we want to do is try to raise those issues within the Pakistani Kashmiri community. We have done a lot of mental health events within sort of the Asian areas to raise profile within our communities to make sure if you've got a problem, address the situation before it gets worse.
Serious mental health problems are also more common than you might think, with 1 in 100 people diagnosed with schizophrenia and 630,000 people contacting specialist mental health services in England at any one time. Serving a diverse population of 1.2 million, Birmingham and Solihull Mental Health NHS Foundation Trust is the country's largest mental health trust that answers directly to local communities. Lakhvir Relon, Director of Diversity.
Well, we have a range of different services across Birmingham and Solihull, and we provide, services for people with common mental health problems like depression, anxiety, stress. We all know about those. But then some of us get so ill that we need more intensive support, where our families can't cope with us anymore, because families get very stressed as well when they see a loved one in so much pain. So we're developing hospitals, we're developing day services, but of course we're very conscious of the fact that across all communities, but particularly for our communities and Asian communities, it's very important to be sensitive to a woman's needs. It's distressful enough having that sort of problem and being mentally disturbed and upset, and the last thing you want is any impact on your dignity and respect, really. So we're providing women-only services so that women feel in a safe environment, and hopefully they can get better, with people around them that love and care, and their families feel confident as well that they're getting better.
Sue Turner, the Chief Executive of Birmingham and Solihull Mental Health NHS Foundation Trust, explains how you can get involved and talks about the perception and fears of mental health faced in the community.
The Foundation Trust is still part of the NHS, but we have more freedoms, financial freedoms in particular. But basically we engage with the local community, we appoint and recruit members so that they have a say in how we run things and what we do as a priority. Each member elects a governor, and then the governors work with myself and the rest of the board in determining what's best for our communities in terms of mental health services. Tonight's a fundraising event for people, particularly working with communities, because many people in our communities suffer from some form of mental health problems. 1 in 4 will experience a mental health problem at some time during the year, and yet we know our communities, all communities, are ashamed, they're fearful of what their friends and their neighbours and their families think about that, and so they tend to hide and feel quite isolated, and in that isolation they actually remain very unwell. So a lot of what we're doing today is to try and get people to engage in very normal events, such as the cricket event tonight. We have many others. To just say, come along, support us helping you and supporting communities, and have your say, really.